So I asked you guys to come on, and I'm massively grateful for that. But as I said before, like, we have seen the figures for sort of starting to come in for 2020. As you guys know already, I'm an advanced life support instructor, a pediatric life support instructor, and also an advanced trauma life support instructor. Oh, and a European one. But anyway, that's just me.
I can introduce myself. I can't rival that. You know,
that's okay. That's okay, because we're learning my stuff today. So I'm just explaining I have the credibility to teach you. So it is really important, because as I've kept sort of banging on the stories, like every single pair of hands can save a life. Like it could, and there are, you know, loads of accounts of children, you know, adults, whatever, all actually cracking on and saving people's lives. But the biggest thing that hit me with the figures from last year was that there was 30,000 cardiac arrests that happened in the UK. Now, to me, that just kind of blew my mind a bit. Like, we see a lot of them. I didn't think there'd be 30,000. Like, that's
that blew me away when you said. I just couldn't believe that it was that many.
I know it is. It's loads and loads, and then 80% of them are recorded as having happened at home.
Yeah. That actually threw me into a bit of a panic, because I actually did take stock and thought, if that happened to me, would I be able to cope?
Yeah,
I don't think I could.
You would, especially after night. I
know, but what? But I know, but it seriously was a bit grounding. It was a bit, because you know, you just kind of do. We are blissfully ignorant to a certain degree, aren't we?
Yeah.
And when I read that, I was just like, oh my God.
Yeah, it's a massive figure, and then I kind of got to thinking a little bit about what we ask when somebody comes in, because I don't know if you guys have seen the critical condition from last night or not, but so obviously our filming stuff is going on online, not online, on Channel 5 at the moment, and Anthony, who's a very good friend of mine and colleague, was talking about a guy that had decided in his kind of early 60s, I think, that he was going to start running, and he'd gone for a run and he'd literally just collapsed. Luckily, he was found by somebody almost immediately who started CPR, and without doubt, like, he just wouldn't have survived without it. You know, you've got 4 minutes that your brain can go without oxygen, so it's really not very long at all. But going back to what I was saying, like, we always ask, what was the downtime? So how long was the heart not beating for? And then on top of that, we always ask, what was the quality of the bystander CPR? So the person that was doing it, when the paramedics rocked up, what was it like? Like, was it not going to be doing anything at all? Because we use that in our decision making.
Gosh.
Which, say it takes 15 minutes for them to get to you, which it hopefully wouldn't do, but say if it did, and your CPR was not really adequate, the decision's almost made.
Yeah.
That you're just not going to survive, or even if you did survive, that your brain is going to be dead. So we've really got to be able to crack on and not worry. Eden actually popped something on earlier from Heels Down and Kick On, is her tag, I think.
Yeah.
Saying, you know, like, she'd just be so scared of starting, like you said, Vic, and, you know, and hurting somebody. And I get that, because in all honesty, sometimes if the person is older, you can feel ribs going, you can feel the costal cartilages sometimes snapping. But when I first did it as a kind of medical student, I felt that. I was like, and they were like, come on, get on, join in. And I was like, oh no, I can't. Well, I'll do it, obviously, but it was really quite scary. And I was really worried about, it was a little old lady, and I thought I was hurting her. But what was really useful is, I think it was Anthony, actually, the guy that I put on before, he just turned around to me and said, look, she's already dead. She's already dead. So you're not hurting her, you're just giving her a chance to live. And I think if you can kind of keep that in your mind, then actually you can, because it's quite brutal, really, isn't it? It's not, you know, a stroke of the chest. It's a good old pump to get it going. But I think it makes it a little bit easier for you to kind of go for it and get that get those compressions started as quickly as possible. So yeah, on that sobering thought.
Yeah, I mean, it's not the normal Friday night out I was expecting, Diane, but it's
Sorry.
fine.
I've got a hot chocolate with Baileys in, if that's any consolation.
In all seriousness, it is it's a seriously important thing.
Yeah, massively.
Really.
But I think, I think if we just, and obviously the other thing that's kind of happened, and I think which is so important this year, is bloody COVID, isn't it?
Yeah.
Because people aren't out and about on the street. There's lots of people around that are on their own at home, maybe, that would have been maybe at work or going to work. The risk factors, I think, are a little bit higher because people are stressed.
Yeah.
They're smoking more because we're in the middle of a pandemic and it's very stressful. They are kind of, let me just see, I think we've just lost Vic. I'll just add her again. They're kind of smoking more. Hi, gorgeous. I think life's more stressful. So I think the actual risk factors have gone up,
I think that's why you said something earlier, which is, so if I went out on a walk, for example, and I found someone collapsed, your first thought at the moment, because of how I've been conditioned because of COVID, is, oh my Christ, don't go near them. But obviously, it's a thing, isn't it?
Yeah, it's a massive thing. And I think we're going to get it reflected in our survival. Sorry, I'm having to slightly move you away from the slight piranha of a horse who's being very naughty. I think we're going to see it in our figures. And I think if we were already at 80%, we've got to go to 90 at least after lockdown with where they're all happening. They've got to, because I just can't see where else, that would... Well, it just wouldn't happen anywhere else. Those would be the ones that happen in the train station, or they happen in the car, or, But I think, I think that's the worry. It's the COVID thing. And you can start. So the issue with COVID is that obviously you can catch it if you're going to do mouth to mouth and stuff like that. And the Resuscitation Council had to put out guidance, not only to the public, but also to healthcare professionals, because we know that that COVID virus particles sort of saturate the air very heavily if somebody's, say, for example, been coughing, which is why we're all wearing the masks. But certainly if we do what's called an aerosol generating procedure, so messing around with people's mouths, airways, if we start pumping on the chest, we're forcing all of that air out of their lungs and out of the back of their throat where the virus sits, and then just shoving it up into the air into your face. So, it is a much higher risk of transmission. And then on top of that, in a pandemic, how do you know that person hasn't collapsed because they actually have COVID? Mm-hmm. So it's it is a problem, and it has been, noticeable in some of the sort of, collapses that have come into work. So they did put some guidance out, and that's what I thought would be useful for us to go through, because not only can we go through the sort of basic life support, if we run through it that it's kind of a COVID basic life support, then you're not going to get it wrong. The only thing that is slightly needs a bit more discussion is the kids. Because in children, they don't have cardiac arrests because there's something wrong with their heart. They just don't. Not unless they've got a congenital heart problem that you already know about. It's like it's almost completely unheard of for them to have a problem due to their heart. So they will arrest because of a problem with their breathing. And they are very, very, very sensitive to a low oxygen rate. So with children, the initial thing that you would do is to give 5 rescue breaths, which in COVID is a problem.
Yeah.
So the advice that has been given, and I think it's perfectly reasonable, and I think it's something that I would do myself, is that the risk to either you or the child contracting COVID and dying of it compared to the risk of that child going on after their breathing has stopped for their heart to stop and then die is 1,000,000 times more of a risk that the child will die than you catching or the child catching COVID and dying. So I think most people don't hang out with other people's kids that they've never met before. So you're going to know whether the child has, even if it's a friend of one of the kids that's come around, you're going to know whether they had COVID symptoms, aren't you? So I think personally, obviously I can't tell anyone what to do, but if I'd have still had children at home and one of their friends or they, like, I would have just cracked on basically and given the breaths. And I think that's reasonable. Obviously if you were somebody maybe that was shielding because you were having chemotherapy, or do you know what I mean, there's always a sort of another side where you could say, well, I'm having chemotherapy, I'm really, really high risk, so actually if this child in my house suddenly does that, it's a problem for me. You can just start the chest compressions, but what they need is they need the oxygen to give them a chance. So yeah, very sad. But anyway, we'll move on from the children because they're very depressing, and we'll talk about the adults. So have you guys done first aid courses?
Yes. I've got Lol here as well. I'm just going to
Hi, Lol.
Lol's like the first aid.
No, I'm just here as a dummy.
Well, you've done quite a lot as well, haven't you? You've done like mountain first aid.
That's not the kind of mouth to mouth we need, Lol.
You.
No, that's at 8:30, not between the hours of 7:30 and 8.
No, we did a couple. We've done 2 child ones now, before the boys.
Yes.
Have you done the kid ones as well? Fair play. I didn't do it at the time when my kids were small. You know, hands up. I'm really bad at first aid. Like, I'm really good if there's kit around, but if it's first aid, I'd go to fish because I'm like, no idea. Like, if you give me a needle and a syringe and some kind of trendy electronic device, I'm great, but first aid is a bit of a nightmare.
You were about to teach us first aid. I just want to get this clear.
But we do this at work. Like, this is the basic stuff, the building blocks, Ria, the building blocks. We could do the building blocks, but if it's like, can you tie this is why the nurses laugh at us. I can't put a sling on. It's ridiculous. Why would I need to? I can't do it. I just look at them like, which way does it go? And they're like, just give it to me. I'll do it. But yeah.
A couple of kid ones. I've done a couple of when I used to be a riding instructor, I did a couple of equine specific ones as well. I can't remember anything, but I'm sure it's in there somewhere.
Okay, Fabioli. So I have got a myriad of not admitting borrowed.
You just kicked that, Sasiani.
Did I? Can you see me? I'm going to need my specs.
Checking.
With me dodgy knee, I've had to put a sponge on the floor. So, right, I am old for this. Okay, so my mate here. So, do you know what rate you're going to do? Do you know any of it, or do you want me to just start at the beginning?
I think we need you to start at the beginning.
Okay,
I can sing the song.
Yeah, can you see me?
I think you need to bring your body back to you because mine is obscured by Diane Fisher. So I don't think we're going to be able to really see what you're doing. But that could just be me. There, that's better. Yeah, perfect.
Is that
enough? Do you agree, Ria?
Yeah,
yeah. That's much better. Perfect, that's fine. Yeah.
Okay, so I'm not going to dance. Like, you're going to put
music.
No, I'm not. I don't think we might have a tech fail for music. But say I'm kind of sauntering along.
It's wrong to be excited by this, Ria.
You see me sauntering?
Yeah, you are sauntering. Wow, look at that woman go. Look at her walk.
And then I come across this old chappy here that's on the floor. Now I'm a little bit worried. Say I'm quite a cool dude. Yeah, so say I kind of come across somebody outside in the street and I have no idea what's gone on, okay, but he's lying there. Now, previously, you will have been taught that you would, first of all, check that it's safe to approach, and that's really important that you do that, particularly if you're outside of the house and inside of the house, because it's stuff like, I don't know, they've tried to drill something into the wall and then they've had an electric shock, so you just need to make sure that it genuinely is safe to approach, although we're always very blasé about it. But check that it is safe to approach. If they're, well, for us because they always come in with the ambo and put them on. So when you kind of do it as an exam, it's like, well, clearly you'd hope the ambulance man hasn't electrocuted the patient. But so check that they haven't got a drill attached to them, because if they get an electric shock, quite often they'll still be holding the thing. If that's the case, I've got an axe, but I haven't got a broom. Get a broom and knock it away from them so that you can actually get there safely.
Jesus Christ.
So what you're going to do first of all is you're going to say, give him a name, girls. What do you want to call him?
Michael.
Michael. Michael, can you hear me? Michael.
If he says
previously, did you?
Imagine if the horse.
We'd have given him a really good shake, yeah, and we would have come down and had a look, listen, and a feel. That's what was previously taught. So you'd have been coming down to here, exposing his chest and bringing his head back slightly to open his airway up, and you'd have been looking to see the rise and fall of the chest, and you'd be feeling the breath against your cheek for 10 seconds. But obviously we can't do that anymore because of COVID. Okay. So what we do now is we come up to him. He's quite mobile, isn't he? And we give it, Michael, can you hear me? Michael. Okay, so if he doesn't respond to me at all, then he's showing no signs of life. So if his breathing is abnormal or absent. So if somebody has a cardiac arrest, they don't always stop breathing. They can do like what we call agonal breathing. So they can kind of be like that, and they'll like be looking as though they're really gasping for air, and they're sort of, I'm not sure my acting skills are up to it, but they'll kind of be like so that's
good. That was good.
Thanks. So that's the sort of breathing they normally exhibit, and that's called agonal breathing, which means the heart has stopped and the breathing's not going to be far behind. So we need to start chest compressions, but we also need to get some help. So if you're on your own, you need to, most people have a phone. So phone your 999 and then put it onto loudspeaker. That's the key. Don't sit here like this, like put it onto loudspeaker and just put it down next to him, because they will talk you through everything that you're doing anyway. So if we're going to crack on with CPR, if you feel yourself, we're going to go for the Ziffy sternum. So the Ziffy sternum, which Maeve talks about a lot as well in her, when we've done the wiggling on the, she'll kill me for saying the wiggling on the ribs, but so it's the V. So this V part that's sat here, that's your guideline. So we go up the chest and we find the V, and then we're going to put our hand above those two fingers. Can you see that okay?
Hang on. You put your fingers like into the V or above the V?
It's just giving you a guide, Ria, as to where your hand, when you put your hand on the chest, it needs to be above those fingers. So where you find the V, your hand goes above, because you want the lower half of the sternum. So have a feel on Lol. You should be able to feel it on him. I can feel it on myself. It's there. So I would put two fingers here and then I would start there.
Okay, I'm with you.
You got it? Vix, have you got it?
Yeah,
I've got it. Bra bit, Six.
It's where my bra is.
Like bra, bottom of the bra, isn't it? You don't have.
It's where your bra sits. Not
Isn't
that
it,
Lol's
Lol?
got a bra on. And if he has, I'm a little bit worried, but I'm not going to ask because that's for 8:30 as well. So you find that, and then you know that your hand has to go above. Now, it doesn't matter what size your hand is at all. And you put the heel of your hand down on the chest, and you interlock the fingers of the other side. So you're like that. And then you keep your arms straight. Don't bend your arms. Keep your arms straight. And you're looking at getting the chest to go down about 5 centimeters, which is about that. So it's a fair push. Okay.
Gosh.
And then you want, when you've pushed down, you have to come, you don't come off, but you must take the weight off so that the chest can actually come back to its original position. Okay. So you will find your place, shove your heel of your hand on, and off you go. And that's it. So you've got your phone there. They'll be giving you the advice of what to do. Now, because we're in COVID, if I'm out in the street, I would take something off me and I would just put it over his face or her face. Yeah. And then honestly, I would turn away. And then you shouldn't have anything coming up. If you're in the house, grab a handy tea towel. It's not going to suffocate them putting this. If you go and get, like if I went and got a bale of hay, then yeah, arse. But, you know, just a tea towel or whatever over and then off you go. You're good to go. Okay. So if you've got a cushion, so you've got to sing the song, which is staying alive in your head. So we're aiming to do 100 to 200 beats per minute. So grab a cushion.
200.
We'll get the song going in a sec.
Hang on, 200
I'll do
times.
it with you. Huh?
100 beats.
Pardon? Hold on, wait.
Michael, are you okay?
That's it.
Down 200 times a minute.
Yeah, 100. So if you do it in time to staying alive, you'll be doing 100 to 200 per minute. Don't forget to shove something over his face. And you're going to turn away when you're doing it to make sure that you're not getting any aerosols up into your face.
Beyond there.
So you find his zippy sternum.
No, look, I'll kill you if I do CPR.
They don't actually do it.
What?
Like,
Right.
are we ready? So we're going to go over. Michael, are you all right? His breathing is. We've recognised it's a cardiac arrest. We throw something over his face. We find the zippy sternum, get our heel down, interlock, look away. What are we doing? Right, I'm going to watch you.
Go on.
So we're going for, oh, look at Teddy. Yeah. Perfect. That's perfect. So arms straight. Just make sure you always think, am I letting the chest come back up again? That's it. So if it ever happens to you, you need to be singing this in your head. And you may have to keep going for quite a long period of time. So I can just drink the hot chocolate.
I didn't need to go to the gym tonight, did I, Diane?
You didn't know. So Ria, you're going to take over from Lol, but Lol's going to count you in. So he's going to say, I'm going to come off 3, 2, 1, and then you're going to go on.
Okay, so I'll take 3, 2.
Well, she's
1.
poised, poor Vic. She's just going to sweat it out.
I should have put this as a workout on my phone.
You should, yeah. Bit quicker, Ria. Let the chest come back up. Perfect. Well done. Perfect. You can kill it now. You can stop now. You can stop now. The ambulance man's arrived.
I really hope that someone just didn't tune in at that moment. Because that's not my strongest angle. That.
Well done. So it isn't hard. Like, it isn't hard. There's like, you know, it's just that change in the look, listen, and feel. Like, we're not doing that no more.
So erase all of that from what you know. Just get rid of that.
Yeah, just get rid of it for now, because in COVID, it's gone. It's gone.
Got you.
Okay, so that's adults. Any questions on the adults?
I've got a question.
Yes.
So it could be that I lost my network at a crucial time. But let's say you're out walking.
Yeah.
And you see Michael on the ground.
Yeah.
At what point do you decide to start doing this? Is it when you can't feel a breath? Is it when 999 tell you to start? Is there a point where you go?
So what you're going to do is, you know already, so you're not going to feel a breath because you're not going to be doing any of that. You're going to give him a good shake and you're going to have a good look at him. If he's grey and he looks awful and he's doing any abnormal breathing, you're going to crack on. If he's fainted, he will whack you off so quick if it's not a cardiac arrest. If he doesn't react, he's arrested.
So if in doubt, just start with the compression.
Just start. Okay. I don't have an issue with that at all.
Because I think that's what a lot of people are worried about, that they'd rather not start than start and like break a rib or whatever. But you're saying go for it.
No, go
Is it-
for it. Have in your head, he's already dead. He's dead. He's just
Okay.
died. I'm going to give
Yeah.
him a chance of living. And if
Got
you
you.
have that in your head, it makes it so much easier, because honestly, you can sometimes feel ribs go, and it's horrible. It is horrible, but
Yeah.
you are that's the reality. They're dead. You're giving them a chance.
Yeah.
Okay?
Yeah.
So the
I'd rather
sequence
have a
is-
broken rib.
I know, not nice.
I'd rather be alive with a broken rib
Well,
than
exactly. You
dead
know,
without.
and if you're really vigorous and ping loads of them, they can be fixed. So, well, not really, but you know what I mean. So, yeah. So that's adults.
So,
So,
do you have
No,
questions
no, it
for
was
Diane?
along the same
so
line.
Lol, any questions?
Hang on, come on.
It's been answered in the same vein. I remember for when you actually used to have to feel for pulses and look for
Yeah.
breath and stuff. The idea was if they're breathing and they're a normal colour, then you can assume you don't have to worry that you're sure then that they have actually got a pulse if they're
Yeah.
breathing and they've got a normal colour. So you wouldn't obviously in that scenario start CPR.
No.
Right.
No, you wouldn't, and you're right. And there will be incidences of people going, "Get off me! What the hell are you doing? I just kind of fainted." You know, there will, but like Vic said before, if they have, you're better off. You need to go as quickly as possible, because time is brain, and brain is. It's not just about keeping the body alive. It really is genuinely about keeping the brain alive, or you know. Otherwise, there's just no point, because then you just end up with a vegetable. I don't know if we're allowed to say that. I'll probably get struck off, but you know what I'm saying. Somebody that is in a vegetative state. So there's no point. No point. So yeah, I mean, if we get out the pandemic soon, hopefully, fingers crossed, then we will go back to a more sort of detailed assessment. But like you say, you know, the colour of somebody that's arrested, it's pretty obvious something is drastically wrong. They don't, you know, they look pretty rough. So there's just been a couple of questions on that. There's a gazillion people that have said hi. So hi to everybody. I'm not going to go through those just because we've got a few. Adela, the horses are in the live, but there we go. If you haven't seen a horse, I'm sorry. There's Siddy. He's having his hay nip. Yeah, everybody says it's very scary. Emma says she learned to do CPR on a first aid course and it's exhausting. She had no idea how much you have to press down to do it properly. It's true, like 5 centimeters, it's a fair like oof to get down, especially in an adult chest. Like they're not designed to be kind of, you know, compressed by 5 centimeters. It's not ideal. There's some bizarre stuff that I'm not even going to read out. So Jane says it's like the early days of HIV when people were scared of strangers. Yeah, I guess it was. I think there was at the first time, you know, when HIV sort of was first recognized, I think there was an issue with people doing mouth to mouth, and, you know, there's no need to be, because it would make no difference to you whatsoever. So it is very similar. Maeve quite liked my dancing, actually. Oh, I don't know if it's my dancing or my other bit. Sorry, there we have something quite weird in the comments. So
What is it?
it's like a kind of, I'll take a picture of it and show it to you afterwards, I think. Michael has not woken up yet. So Jane says, when she was nursing, we were taught to give the chest a great big thump before starting compressions. Don't they do that anymore? Yes. So if we see somebody with a monitored VF arrest, so there's two ways of the heart stopping beating. So one is if it just literally stops still and it doesn't do anything. And then there's a rhythm called VF, and I always kind of describe it as if you had a jelly on a plate, if you kind of shook it, you know, like the heart is kind of shaking the jelly. It's like that rhythm. So very occasionally, and I've seen it happen once with a very cool emergency medicine consultant who kind of walked past a monitor, looked at it, went back, went bang, and then carried on walking because the patient just went straight back into a sinus rhythm. But so you can do a precordial thump, which is what it's called, Jane, as I'm sure you know, but the reality is you can only do it in a witnessed VF arrest. So you're not going to see that if it's Rhea and Vic. They're not going to be with somebody on the monitor. So Sarah, Larry. So Sarah put a comment on before, actually. She's amazing. So she's put, Thanks, Dan. I did CPR on my husband and I felt his ribs crack. Thankfully, he survived and he now has a pacemaker. Oh, it's a fantastic video you're doing, guys, and everyone should listen. So she put a comment actually under the Facebook event because of lockdown, her husband was working at home and he collapsed and had a cardiac arrest. Recently, yeah, in lockdown, and she started CPR and he's survived and he has a pacemaker now. So I'm so proud of her. She's amazing. So yeah, Mark says that your cat's stealing the screen.
I'm trying really hard not to pay any attention to her.
She's very beautiful. And I think that's sort of Hannah says, so Hannah's had to do it. Hannah Bartley, she said, when I had to do it, I just went into auto. My training kicked in and I just did what I had to do. Yeah, that's pretty amazing. And then Mark says, well said on the HIV. Yeah, I mean, people just need to not even think about that. That's just not necessary to even think about. So we'll move on to kiddies, because the kiddies are, I suppose the only other thing to say about the adult stuff is make sure that you phone the 999 services, because like even just doing a tiny bit, like you're knackered. So you need to make sure you phone the services. If you're out and about like equestrians are, the 3 words app is something that you need. So if you haven't got that, you need to download that onto your phone, because that's what all the emergency services use. So then we can at least find where you are. And then obviously if when you tell them on the call, if there's 2 of you and there's an AED, so an automated defibrillator near you, they will tell you where to go and get it. If that's the case, it tells you exactly what to do. Just to open the box, slap the pads on. It tells you where to put the pads on, and you just turn it on and you do what it tells you to do. So you don't need to know anything apart from put the pads on. So Sue's just said, are you saying don't do rescue breaths because of COVID or do it through the T-towel? I am saying in an adult, do not do rescue breaths. Do not do rescue breaths. With children, it's your decision, but the Resource Council say it's more risk to the child if you don't than if you give it COVID or it gives you COVID. Emily says, yes. So Emily says, you need to move a person to a hard surface if you found them, say, for example, on a bed. Yeah, if you've got a really like bouncy bed or something, and then you're kind of like doing it and they're pinging all over the place, just drag them onto the floor, which could be quite difficult if you're on your own. But yeah, you want a hard surface underneath them if you can. So Martha's just put a link on for everyone. So there is a link to the app for 3 words, which is brilliant. Okay, you guys happy with that then, that you could crack on?
Yeah. You know, I instantly feel better for like what I would do. Yeah, honestly.
Because I think sometimes it's just having a little plan, isn't it? It's having a little plan. You've had a little run through. I mean, heaven forbid it ever happens, and touch every bit of wood that I have that it never will. But at least you will go, oh, right, okay, I've got to do this.
Yeah.
And you can't do anything wrong because they're dead. So you cannot do anything wrong.
Yeah.
So you may as well just give it a go. Yeah.
Yeah.
So we will have a look at the Kiddle Widdles. So I find that, as you know from my podcast with you, Rhea, I'm not a great fan of children being sick.
I think I'm with you there. I like mine.
Oh yeah,
I like mine. I like
children, like per se, as a group. Love them, in fact. However, I really don't like it when they're sick, because they make me slightly feel like I'm going to have diarrhea. So I don't like them. For that reason alone.
Did not expect that, Diane.
Yeah. Well, I'll be open. So we look at kids in 2 ways. So obviously there's a big range in children. So they can be kind of this size, which are the really scary ones. And then they can be kind of this size, or even up to the adult size. So with sort of basic life support, it's only really split into below 1 year old and over 1 year old. So below 1, they're an infant, and we're not going to cover neonate because it just gets too confusing. Okay. So with the kiddies, it's a slightly different scenario, because as we said before, the thing with kids is they do not tend to arrest because there's a problem with their heart. They tend to arrest because there's a problem with their breathing, and because of that, their heart stops. So that's why we have to kind of say to ourselves, do you know what, then we're going to give those 5 initial breaths. Now, I'm not sitting here in a pandemic saying you must give 5 breaths. I'm just telling you that the Resuscitation Council's guidelines are that it is more risky not to do anything from the child's point of view, because they will, if they've stopped breathing, their heart will stop and they will die. If you give them mouth to mouth and they have COVID, you may get COVID, they may get COVID off you. You won't necessarily die from that. So you've just got to kind of weigh that up. And I think most people don't tend to have random children around. So you're going to know the child as well. So slightly different. So again, you have to do that safe to approach things, because kiddies do stupid things like, oh, I'll put the screwdriver into the plug socket and things like that. And again, you know, they do sort of do the most bizarre things. And they also have a horrible, horrible habit of putting things in their mouths and then leaping around the place. So you're going to do the same. You're going to check for signs of life, but you are going to actually open up that airway and you're going to have a look inside just to see if you can see anything. So to open up the airway, can you see okay?
Yeah.
Okay, right. So to open up the airway on a child of above the age of 1, you put your hand on their forehead.
You just said that your signal went. Could you just repeat that? Your signal went a bit.
Yeah, so this is just so you go over and you say, oh, hello, little, what's he called?
Tommy, can you hear me? So he's not answering me and his breathing looks a bit funny. Okay, so I'm going to open his airway up. So I'm going to put my left hand, I'm right-handed, so obviously you'll do this opposite if you're left-handed, but I'm going to put my left hand onto his forehead and I'm going to use my right hand and I'm just going to lift his chin up. I'm not going to do this in case he's done something trauma-wise. But I'm just going to do enough just to open up that airway. And I'm going to actually have a look in, because if I can see a piece of Lego or whatever, I can move it. Yeah. So I'm going to open up his airway. And then if his breathing is abnormal, so it's this looking for signs of life. But again, even before, you would have definitely done this whole look, listen, feel, looking at the rise and fall of the chest. It's not advisable to do that, and again, it's pretty bloody obvious if they've had a respiratory arrest. They go blue pretty quickly. So if they've got to that point, they're going to look incredibly, incredibly sick. So don't be doing any of that. Just have a look and see if there's anything that you can see that is obscuring that airway. If there is not, then or even if there is, you need to give the 5 rescue breaths. Yes.
If you can see something, should you be putting your fingers in to try and retrieve it or not?
If you can get it easily without pushing it down further, yeah, but don't be fishing around, because if it's done enough to cause a respiratory arrest, they'd have been coughing like mad to get it out. So if it's done enough to cause a respiratory arrest, I mean, if you can get it. But the problem is with poking around when you are very, very stressed as well, is you can push it down further and then you can't even blow a breath in.
Yeah.
So if it's dead obvious and you can grab it. But normally, you can't grab it, So, yeah. So if you can and it's easy, get it out if you can't. So forehead open, and then we're going to do the 5 rescue breaths. So there are, depending on the size of the child, there's 2 ways of doing this. So if it's this size of child, so an infant, then what you will do is you will put your whole of your mouth over the nose and the mouth. Yeah. So you're going to. Sorry, this poor baby's got to go on my step. So you're going to. So there's a slight difference with an infant, but you're going to literally. Yeah. So over the nose and the mouth. If you are doing it with a sort of I say a normal sized child, but you know what I mean, over the age of 1. Then you're going to pinch the nose to occlude the nose whilst keeping this open, and then you're going to put your mouth to form a good seal around here. Keep your fingers there on the chin. It actually makes it a bit easier for you, and then you're going to give 5 rescue breaths. And you want to look and see, is the chest moving at all? And you want to check that it actually does go up and down. If it won't budge at all, and you've definitely got a good seal, and you're definitely getting, you know, or trying to get the air in, you just need to carry on to the CPR. There's no point. There's probably, well, there will be something stuck that's causing the issue. So it's essentially the same. It's just that you're going to use the heel of your hand. If you find you need to use 2, it's fine. It doesn't matter. You're going to do exactly the same. The only difference is with this, we are going to do the breaths, and we're going to go with a 15 to 2. So with an adult at the moment, you just keep going. You do not stop. You can swap in and out if you need to, but you just don't stop until you physically cannot do it anymore. Okay, but with the child, you're going to go with a 15 to 2. So you're going to do exactly the same. You're going to find the zippy sternum, but you're going to just use the heel of your hand, but you're aiming for the lower part of the sternum. Thank you, Jasper. And then you're just going to go, same thing, staying alive, exactly the same. 15, and then your 2 rescue breaths. I blew him up that time, must have got him better.
Right, should we?
You'll have to do. You've got the bear, Ria, so we'll watch you.
Yeah, so watch you now, Ria. So you're going to do the 15 to 2. Remember, we're going to do the 5 rescue breaths first.
I mean, how does that work with the bear then? How does that work with the bear?
Well, it's got a very big nose you've got to get in your mouth.
Is this actually happening?
That's a quote, isn't it? That's a quote.
I can't wait for that quote to come live.
Yeah, I mean, I'm excited by it too. But this is only because I like you. And Loz. Oh, right.
Save him, Ria. Save him.
Save Tommy, Ria. Save Tommy.
I mean, Tommy's got bigger issues, and the fact he's not breathing. Right. Oh, right. Okay. So you shake him. I mean, he's. Is
there anything in his mouth?
I don't know. He's a bear log.
Look into his mouth. Is there an obstruction?
It's sewn shut.
Is there an obstruction behind his sewn shut mouth?
No.
We found the problem. His mouth's sewn shut.
Oh, exactly. It's fine, Diana. Fixed it.
Right.
Well, there we go. So Kate's just made a point, and I know that Kate teaches for the University of Nurses and says that the latest advice is during COVID is not to do rescue breaths. No, I do appreciate that, but if you actually look on the Resus Council guideline at the moment, what they're saying is that what I said before is that the risk is of you or the child dying from COVID is less than the child dying. So then people need to make their own personal choice. I think if it's your own child, which it is likely to be, and you've been living with that child and that child's got no signs of COVID and neither of you, I think that people are going to do it anyway, and I'd rather they did it correctly. So I'm not telling people to do breaths if they don't want to in a pandemic, and I'm certainly not telling them to do it in adults, but in children, the guidance is, well, the guidance isn't different. It says do not do it. However, there is a statement that you can sort of refer back to. So, yeah, so you're going to give your, hello, Tommy, are you okay?
Yeah. Hello, Tommy, are you okay? He's not good.
No. Okay, and he's a very funny colour, and he doesn't appear to be breathing.
No. So we
so you're going to open up his airway. So you're going to use one hand on his forehead and just bring that back, and then 2 fingers underneath his chin. Yes, Siddy. Thank you.
I mean, this is not the best. Yeah, we're on it. We're on
no,
it. Yeah.
But you know what I'm saying. And then you're going to pinch his nose. That's an enormous nose. And then you're going to give 5 rescue breaths, but you're going to give time in between to see that the chest is going up and down.
Okay.
She's been waiting her entire life for this moment, hasn't she,
She
Diane?
has, yeah. She's just
Yeah.
smashing it.
I know.
Lost count. Is that 4?
4.
Feels like it's been a million.
Lol's counting, don't worry.
Okay, it's 5.
Well, air is going in, Diane.
Well, that's fabulous. Okay, so there's a couple of ways of feeling for a pulse. So normally if you go through the normal child algorithm now, then you would look for a pulse in a child. So there are a few different places. So get your fingers ready. So you've got carotids, don't feel both at the same time, but you've got the ones in your neck. If you feel both at the same time, you might faint. So don't do that. So you can feel the one in your neck, which is here. Can you feel that one?
Oh,
Yeah.
yeah.
Yeah. So in a child, and particularly a young child, they're quite difficult to feel. So you've got two options really. So one is the brachial. So if you go to the inside of your elbow crease, go to the inside, you'll have a pulse there.
I think I might be dead, Diane.
No, you're not.
Are you talking about going above the elbow crease or below?
Yeah. So it's kind of, that's my elbow crease there.
So it's above, right.
It's just on the inside here.
That's where mine is.
Yeah. Can you see Lars?
I think I'm dead, Diane.
I am too. It's a problem. I'm worried.
It's okay because we can always go for the groin.
Oh, Jesus.
We can always go for the groin.
Yeah.
Yeah, you heard that right.
Okay.
So if you,
I can
you
feel
need
it now.
to feel a pulse in the groin.
I'm fine.
You've got between your hip here, the anterior superior iliac spine, and here, if you go halfway there, you'll feel a pulse.
Jesus Christ. I think I might be dead.
I think I'm dead, Diane.
You're not dead, you're just feeling in the wrong place. It's in the middle, there, or there.
How good.
How hard can I be pushing?
You shouldn't have to push that hard.
Should it be hurting?
Well, if it's hurting and you can't feel it, you need to move along a bit.
I'm going to go back to my neck because I definitely feel alive in my
So
neck.
have a feel of those when you're in bed, and then you'll actually be able to feel it. Sometimes you need to lie down, and then you can actually feel them in your groin.
I'm good with the neck though. I could do that. The neck was fine.
Okay, so that's fine. So then the only other difference is babies, because that changes, or not babies, but the under one, because that changes how we actually do the CPR. So if you've got a little beaner like this one, can you see this one okay, or do I need to put it on the step?
Put them on a step. Yeah.
Can you see her now?
Yes.
Oh, enough, yeah?
Yep.
So how you do the compressions for this depends on whether there's one or two of you, okay? Because obviously if you did that, you're going to just rupture its spleen. So with children of this age, their abdominal organs are a lot lower than ours are. So you can't do the kind of heel compressions. It's no good. So what you do is you feel for the sternum. You can still feel a sternum in a child like of this age. You can still feel where their sternum is here in their rib cage. And you just use 2 fingers. And that's it. And then you're going at a 15 to 2.
So you feel the sternum and
Yeah.
you do it
Above.
there, above.
But
Feel
2
the
fingers.
sternum, go above 2 fingers. Okay.
If there's 2 of you, then you're going to get in each other's way purely because of the size of the child. So what you do then is you circle the child's chest like this. Can you see it? I can't really see whether you can see.
Yeah.
And then you can put your thumbs like this.
Yeah. Yeah.
Then, which leaves the head end free for the other
Yeah,
person.
I see. For the other person. Yeah.
And
Just make sure that you don't kind of squeeze at the back as well. You just want to make sure that you're actually only moving those thumbs. And really importantly with this is because everyone is so stressed, they're like, You've got
Yeah.
to make sure that you allow that chest to recoil. That's really
And how deep?
This one is around 3 centimeters.
Okay.
And is it still to the same kind of rhythm, the same sort of speed?
Yeah, exactly the same. You're going on a 15 to 2. What they say is, because none of you are going to like suddenly learn pediatric life support. So what they say is take your rhythms from the adults, and you're not going to go far wrong. Because again, this child is dead. So anything you do is better than doing nothing. Yeah.
Yeah.
Are you happy with that one?
Yeah. Yeah.
Fabulous, Kate. So the question is when do you stop?
Yeah. When do you stop, Diane?
Yeah.
I think
Go on. When do you stop?
it's
When
the ambulance
when the paramedic.
or when you think you're going to pass out, like if you are like pumping away and then you think you are actually going to faint or pass out,
Yeah.
but genuinely not kind of, oh, I'm a bit tired, as in, you seriously think you're going to keel over.
Yeah. So there are a few times so if it is that actually it's just, a temporary thing and it stops and actually everything's all right afterwards, they might suddenly get off. I actually feel okay. And that doesn't mean that they didn't have a cardiac arrest. They may have got into a funny rhythm and then you've actually got them out of it and then off they go again. So it's signs of life. So obvious signs of life. So gagging, coughing, any sort of attempt to kind of move and whatever. And quite a lot of people will sort of grunt and really almost like scream. It's not very nice, but they will, because they've had such a shortage of oxygen to the brain. So the behavior afterwards is going to be very, very abnormal. But you just need to stay with them and just keep a really close eye on them until the paramedics come. Like, just don't go anywhere. Stay exactly where you are, because it may happen again. The other one, as you said quite rightly, is when the paramedics arrive, they're going to take over. But give them, like, when they walk in, don't just stop, because they've got to actually get through the door, drop their kit and get the monitors and things attached. And if they can see that you're doing good CPR, one of the there's usually 2 of them and a critical care paramedic that comes, just don't stop until they tell you to stop. If the person that on your phone, like, so the call handler tells you to stop, you stop. And then, as Ria said, and as you said, Becky, is if you are you cannot physically do it anymore. And that happens quite quickly. Like, we swap in and out a lot, even just doing a full, we do cycles, and even just doing a full cycle is knackering, particularly in PPE.
Yeah.
Like, you're sweating like a pig. Absolutely.
Do you like clamber onto the bed? Are you one of those doctors that would clamber onto the bed to do it?
No, I have a step.
You have a step. Well, that's as is exciting.
Yeah. Look, if somebody I would do if we had to transport the patient to somewhere. Like, if we had
is that what happens
to somewhere, then yeah, if I needed to, I would. But I'm not convinced it's necessary. No. If you're staying static in a place, like, why do you need to get on? I mean, it would make it easier because you're just literally using gravity, aren't you? But I think sometimes you just need to get higher, and by being higher, you can kind of use your actual weight to get down and just get into that rhythm. Yeah. So you've just got to keep that staying alive in your head and keep going and keep going. Yeah. But yeah. So any questions? Any questiones?
Hang on.
I have one. If you're checking for a pulse, you were saying, in the children and the infants.
Yeah.
If you can't find a pulse, that doesn't necessarily mean it's not there, doesn't it? It might just be you can't find it. So do you take it as a sort of positive? So if you find it, great, it's there. But if you don't find it, do you then just go to common sense, which is look at them and see, what do they look like? Are they blue? Or are they fine with a? Do you know what I mean?
Yeah. So if they look. So the first thing I would look at is their breathing. So if their breathing is abnormal and you cannot find a pulse, you start.
Yeah.
That's it. You just start.
Sure.
Right then, let me just have a look down here. So Emma says, what technique would you use on a teenager, adult, or child? just depends on the age, Emma, but they would say 15 to 2 on the pediatric stuff, but teenager, we tend to use adult, because the drug doses are for adults as well. But you'd be going with a 15 to 2. Nick,
can I just ask something
go.
there? So if, let's say, it's your own child, so it's your own 15-year-old teenager, so you're going to feel more keen to do the 15 to 2, aren't you? Because that is the ultimate still. I know we don't want to do it in an adult, but if it was your own child,
your own 15-year-old, if it was my 15-year-old, I'd do 15 to 2. And the reason you're doing the 15 to 2 is you're giving more chance of, so obviously you're putting oxygen in from your expired air, so not a great deal, but you are putting more in than they're getting, and then you're pumping that oxygen around the body with those 15. So if you do a 30 to 2, clearly you put less oxygen in than if you were doing the 15 to 2. So go for the 15 to 2.
And if you were so inclined and you did 15 to 2 to an adult, regardless of whether you knew them or not, with even in this time of COVID fear, is that okay? If that was your own decision and you just thought, I just have to save this person and I want to give them 15 to 2 or whatever it is that going
30.
to be?
So for an adult, it's 30 to 2.
Yeah.
So there was a lot of research into whether about whether actually you needed to do rescue breaths at all, because just by the action of doing like that into the chest, it actually, with the physics of it, it kind of draws air in, and then by letting it off makes air go out. Like our normal breath out, we can go, but most of the time we don't actually we don't put any muscle energy into breathing out. It just relaxes, and by doing that it comes out. So there was a lot of research about, do we actually need to do rescue breaths at all, and can you just do the compressions and that's that? And there was a phase for a while that it looked like we were going to move to no rescue breaths at all. But I think I think in a pandemic, I think you follow the pure chest compressions unless it's a pediatric patient, and then it is your choice. And I will pop on the COVID stuff onto this bottom of this so that people can see, because obviously it's barn door no, but they have this statement so that people can make a decision and feel happy about their decision.
I realised as I said that, of course, you had actually stressed earlier that for children, it's the lack of breathing that actually is more of a problem. So that's what it is, isn't it? It's not that we're taking anything away from an adult. It's just what that child needs more.
Because their hearts are normally they've not smoked. They may have had a few ciders, but they haven't had the amount that we've had, let's be honest. Their diets are usually, even if they've been poor, they haven't got the sort of coronary problems that we would have as adults. So it's very, very unlikely to be a cardiac cause. It's going to be something within the respiratory system that's caused a problem, or they've swallowed something or whatever.
Right. Yeah,
cool.
Got you.
Cool. So that's it, really. That's all. That's my little thing. You can go on to, there is something that's quite good, which I think would be quite good for children to do. So there's a website called www.lifesavers.org, which is like a video game to teach children how to do CPR. Again, I'll put that underneath. And also on the resuscouncil.org, they've got little videos now, so that they're having this big push for people in lockdown to learn CPR. So there are some resources which I will put on underneath this as well. But I have to say a massive thank you for supporting and coming on. You know how passionate I am about making people safer.
You're making a huge difference, darling. It's brilliant. Honestly. Every single one of your lives, they're just, I don't know how you make it so entertaining, but you really do. You really do. And you install such confidence in us.
I'm trying.
No, it's brilliant. It's absolutely fabulous. I know that I feel better already. I really do. And it's only taken an hour.